Buthaina, Ameri, and Prof. Saiful to chair the next session. Thank you.
Assalamu alaikum. My name is Buthaina Ameri. I'm a senior specialist at the Federal Authority for Nuclear Regulation in the Radiation Safety Department. It's my pleasure to chair this session along with Professor Saiful, and the session would address directly one of our most pressing challenges and responsibilities in radiation oncology today. The session title, From Global Priorities to Regional Actions, Advancing Equitable Radiotherapy in the AMSTRO region. And the session would explore how global cancer control goals would be translated into meaningful, practical action within our region. With that, I would like to introduce our speaker, Dr. May Abdel-Wahab. Dr. May, who is the Director of Human Health in the International Atomic Energy Agency in Vienna, Austria. She leads a multidisciplinary team of nutrition specialists, radiologists, nuclear medicine physicians, radiation oncologists, radiobiologists, and medical physicists to support member states in strengthening cancer control and radiotherapy services. Dr. Abdel-Wahab is internationally recognized with her leadership in global oncology capacity building and quality improvement. Her work has focused on expanding access to safe, effective radiation medicine and advancing equitable cancer care worldwide. Dr. May, the floor is yours.
I just wanted to add that she flew in just for the day, to come here to give this presentation. And she was in Cape Town just a few days ago. So really appreciate your commitment and support. Let's give another round of applause.
We know when you say there's something like this, you can't say no, right? So thank you very much. And it's a pleasure to be here. Thank you for the invitation and to the board. And this is kind of a difficult subject to cover in 20 minutes, but I'll try my best. So first, I was told about the MENA region and how we define it. And there are many different ways, but here I share with you the WHO definition and the list of countries. The IAEA uses a different definition by continent. So this is important in terms of forming the collaboration within a region. So when we're talking about the future, we want to know exactly what are the demographics, what is the characteristics that we see. So we know it's a region of rapid growth. We know that we have predominantly young population and 50% under 30. And we also know with that young population, there's the gradual aging that will lead to other types of issues in the future. So this demographic change that could happen will have a significant impact, and we have to plan for it. So some of the things that we see coming down the pike is an increase in cancer incidence. We've heard that before, and because of that, we need to be prepared. We cannot be reactive. So it'll increase by more than 70% in 2040. Not only that, but the cancer survival rates now remain lower than global averages in some countries. So we already have a double whammy, so to speak, and we really need to address it. So we'll talk specifically, because of the conference we have today, about imaging and radiotherapy in modern clinical care. I'm preaching to the choir. Everybody knows that radiotherapy is needed in over 50% of cases. In most LMIC countries, it's 70% or 80% because we see more advanced cases. Then, of course, imaging, we all know that it's extremely important in modern management. And so we have supporting diagnosis and disease staging and et cetera, et cetera. So it's an important part of the health infrastructure in any country. But it's not about the machines. And a lot of time we talk about the machines, the centers, and so forth. We've heard some of our colleagues say today about the trained personnel, which is extremely important, and the knowledge in the country, which will also, by the way, support the expansion within the country. Quality assurance, if we put in machines and we have trained people and we don't have a good quality assurance plan, then we're losing a lot of the edge that we could get and the movement forward. Of course, safety is important, and we've heard it from some of the speakers, integration to clinical pathways. But even if we have everything in there, as we heard from Princess Dina and others, within countries and between countries, there's a lot of difference. We have also between urban and rural areas. We have between public and private sector, substantial inequities. A lot of them are financial and economic, etc. So does it make sense from an economic perspective? Because as medical interested people and medical personnel, we understand it's the human factor and all that. But when we're discussing it with ministers of finance, for example, we really need to have the economic part down pat. And how do we have the economic part? We have to collect data, and we have to analyze it, and we have to do health economic analysis. So this is an example of something that we did that supported the eventual policy change. So here you see a return on investment of $12 for every $1, and in the trillions as well, if you want to talk about investment in billions at the global level, with a $1 trillion benefit. This is the kind of thing that we need to be doing more of, but it requires data, and that's always a challenge. So if we look at the region, we can see that the investment, the output or the benefit varies between different regions depending on what's happening right now and what the extra benefit is going to be. But it's always there. Now, if we think about gaps, I want to share something from our IAEA database, the Imagine database. And it shows very clearly, and this is a simplified version, of course, that if you go from low income to high income, it's a very big difference in terms of access to care, right? So 1 million persons covered by machines, whether it's SPECT or PET, for example, okay? And you go one covering 250 million to one covering 0.3 million. It's enormous, the difference. But not only that, we have a workforce. And on the horizon, we'll see more and more of the theranostics opportunities. Right now, it's being used by many or developed by many companies, pharmaceutical companies that are interested. So I think this will expand. We heard the talk earlier about lack of support for radiotherapy, for example, and more support for pharmaceuticals. So for radiopharmaceuticals, we are going to see a huge change, a tsunami of change in this area. With it comes workforce. And as you can see, the workforce is quite spotty, especially in low and middle income countries. Okay, so let's look at specifically the region in terms of machines. So if you look at CT scans per million population, you see that there's a significant variation throughout the region. And you can see that very few of them have the needed number of machines, which, as you can see here, over 10 to 15 CT per million would be supportive of broad access. But if you look at PET CTs, it's much more challenging even, and much more complicated as a machine. So if we're thinking about the future theranostics, there's going to be a huge gap between what we're doing and what people who have more resources might be doing. So we have to really be sure that it's equal or equity, as one of the speakers said. So talking about human resources for imaging, if you took the big picture of it, you see that we have to have 100 radiologists per million, but that's not the case in most countries in MENA. So we really have a lot of work to do in terms of promoting our human resources. Radiologists per million, this is self-explanatory. You need to have many more radiologists. It's different. Some countries, it's much worse than others, but across the board, we need more. Nuclear medicine physicians are always more difficult because, as I said, nuclear medicine is not as easy to implement and so forth, and the training and everything. So you always see this pattern of nuclear medicine physicians per million and nuclear medicine equipment per million is going to be more challenging to address. And I have the numbers, you'll get them on the slides. Of course, I won't get into that. So we'll shift to radiotherapy, and we can see again the same picture where we have a spotty access to radiotherapy in different areas. But if we want to take a deeper look to see, has there been an improvement? Now we know it's still not there, but has there been an improvement? We can look at specific numbers, and you see the red line here is basically our region, and it says very clearly that there is an improvement that has been happening. There's less cobalt, more Linux that have been happening, but also the numbers have gone up. So we're doing well, we're moving forward, but not fast enough, especially looking at the demographics and the epidemiology that we expect in the future. So now we get to the radiotherapy workforce. And for the workforce, we found that we need an increase of more than 60%. Now, we did a survey of training programs around the world, and there are not a lot of training programs. So to reach that level, we need to change how we're training people. We need to use not just AI to find depending on the best way a person specifically learns, so personalized training, but also things like virtual reality and other things that could help us increase the number of people that we can train per attending physician, for example. So I wanted to touch base on regional radiotherapy status, and we see there are a few publications from people around here that I've seen today. So this one looked at specifically radiation therapy in the Arab world. And as I said, cancer incidence is growing 1.8-fold in the Arab world by 2030. And when we look at policy and planning, like NCCP, we're doing very well. 80% have NCCPs. That's great. But an NCCP is a piece of paper. It doesn't mean anything unless you're able to implement. And so that is the issue. More than half, less than half, excuse me, function effectively. So it's research, implementation is very important. And we heard discussions about that, management of this situation. So what do we have to do? We have to scale infrastructure. We have to expand education. We have to strengthen national cancer control programs with the implementation intact. And we have to ensure equitable access. So what are the factors that determine this? Is it just money, economic status, GDP per capita? Well, that definitely is important because it is significantly related to that. But then there are other factors, and I can think of at least one country that used to have the highest number of Linux per million a few years ago, and after conflict did not have a single radiotherapy machine. And that is so sad and heartbreaking to see how politics can really affect people this way. So anyway, so basically political stability. If you have money, it's great. But if you don't have political stability, you haven't really done anything because you're not going to get anywhere. So comparing politically stable to unstable countries, there's a statistically significant difference. Why is that? Because first of all, there's no access, just getting to the centers. Second of all, infrastructure investment is not done because they're putting money in other things. And of course, try to get maintenance and service in any place and try to get it in a war zone, it's not going to happen. So what are the other factors that we need to think about, and all of these factors eventually will translate into things that AMSTRO can do to support. So healthcare workforce size is important. The infrastructure quality, we heard a little bit about that. And of course, national health priorities. So there has to be the political will always, right? And then finally, if we look at in Arab countries, we know that there's a shortage, and these are the numbers that you can review, but an average is 0.84 machines per 1,000 cancer patients. It should be 1 per 500. So we need action to close the gap. And some of the actions are, again, workforce training. You'll hear it again and again, because workforce training is not to be able to just treat a patient, but to also provide guidance within the country to expand, and to provide guidance to be able to have the quality assurance and auditing programs that you need. Then you have better planning, we talked, initiatives to reduce this. So in other words, if you look at any of the literature right now, you'll find that they're the similar, recommendations again and again and again. It's no secret. The only additional one in one of them is research, which I will touch upon because it's extremely important. We might think of it as something that's a secondary thing, but I think it's essential in many ways. So if you look at 7 of the 13 Arab countries, lung cancer is the #1 killer, incidence and mortality. #1, something that's to some degree preventable. Not all of them are, but to some degree, some of them are preventable, smoking related. And screening gaps are there. Now, we do have screening programs that are starting in the UAE, in Saudi Arabia, and in Egypt. So there is hope yet, but it's still, at the early stages. Awareness, we've heard some people talk about that as well. We need to educate the population. That's extremely important. And to avoid late diagnosis. So what other issues do we have to consider when we're thinking of improving the status of the countries? One is the peer review, and this is essential for the quality, for the safety, and so forth. But we don't see it implemented equally across the region. So this is an area that AMSTRO could help by trying to support these networks, these programs, and even at the regional level, you could have auditing programs and so forth. And of course, increasing awareness so physicians know, but most do. Okay, so what can the IAEA do to support? We have some quality assurance opportunities, whether it's through the dosimetry lab that you can see here. And the dosimetry lab is the central lab for what we call the secondary standard dosimetry lab network. And that's a network of labs that support each other and support other places around the world, other labs around the world, other centers around the world. So this is a very nice example of collaboration. Then you have the audit program for places who don't have these labs to check the doses that are coming out of these machines. Then you could go directly to the IAEA and get some postal audits done to know that your output is right. Because one thing like that could affect 500 patients a year. And then you have quality assurance and auditing. We have quantum, quadril, and quattro, radiation oncology, radiology, and nuclear medicine. And many of our colleagues here who are into global health have participated in these audits. But it's not enough to do the audits, it's also to train others. So we get full teams from different countries. I mean, we had a recent one from Latin America that we had the whole medical physics and radiation oncology team, all of them come and train, and then they go back to their countries and train. We had 30 countries represented. So this kind of thing really helps spread the word, so to speak, and the experience. So if we look at the MENA region, what do we see in terms of secondary standard dosimetry network membership? So as you can see, we have 12 members in the MENA region, and you can see them listed here. I won't read them to you, you can see them right there. But the interesting thing is we had some that were members, but then there was damage, so they're out, like Libya. And we have some that are not a member, but have labs already, like Iraq, Lebanon, and of course, Libya. And then there's some that there's no information at all, or they're in the process like Qatar and like Oman. But then also we have a few that don't have anything at all, as you can see right here. So, okay, if they don't have anything, we can support them with postal audits, as I said. And here you can see the countries that we have supported. I think Morocco was very prominently represented, but also Saudi Arabia in terms of us supporting them with postal audits. But you can see across the board, many countries in the region depend on these postal audits for support. These are the SSDL beams, meaning like the IAEA looks at these labs and supports them, and then they go and support the hospitals afterwards. So you can see, again, many countries in the region have been supported. And now we want to think about, okay, so what about research? I mentioned that this is important because not only does it allow us to do research that is context specific, which varies, that is specific to the population, but also it trains the next generation of researchers. It also allows us to do new treatments in a very safe manner. So this is really important. Here you can see an example where we look at cervical cancer and breast cancer, and you can see that even for the clinical trials, there's a hole there somewhere, right? Very few. So it's still not really fair. And then if you look at the research funding, it's very clear that the research funding is concentrated in certain areas. And again, radiotherapy is much more affected by this because we do not get a lot of support in terms of clinical trials from pharma. So we're talking about general clinical trials, phase 2, phase 3, but even phase 1 are important, and we need to consider that. Regional research capacity for phase 1 trials. So it's going to take a while, of course, because it's more complex than the other types of trials, but we need to develop this clinical research infrastructure. Now, if there is interest within AMSTRO or others in supporting this, the IAEA has anchor centers, regional centers of excellence, many of them in the MENA region, who we hope to be the centers to develop this huge research infrastructure. And then from there, as we heard before, other centers can follow suit in the region. It's always like that. You start somewhere and everybody else will want to do the same. So if we look at some of the literature on clinical trial access, it's pretty obvious within the region that there's lack of trained researchers, weak institutional support, minimal funding, the usual things that happen when you're trying to do research, the usual obstacles. So you have major deficiencies, and so we need these cross-regional partnerships. And it's documented. We have many publications on that. So what does the IAEA do? We have research trials, coordinated research projects, we call them. And these are basically clinical trials, patterns of care studies, and assessing interventions like educational interventions. We put a lot of money in training people, but we want to see, does it work? Or we just train people and let them go and think we're doing something. So we actually have studies that look at the effect of training on these people. And now we're using AI to help with some of that. So this is just an example. And as you can see, countries around the world have participated. Every study has 5 to 10 centers. So it's really a joint effort. And this is an example of one. Some of the people here were at this one, and I believe the scientific officers also here. And this is using the anchor centers to look at CT-based planning in prostate cancer, for example. So all of these things at the regional level should be done, which is regulatory alignment, improving that, strengthening infrastructure, expanding training in research, fostering collaboration, and increasing public engagement for people to want to go into trials. So now I'm going to just touch very quickly on pillars of Rays of Hope. And many of you have heard of this initiative that's run by the IAEA and was announced about 3 years ago. So there are 3 main pillars. One is to support access to buy equipment, train people. The second is new because we've been training people and buying equipment for a long time now, decades. The second one is the anchor centers, and these are going to be very important in helping the regions move forward. They're centers of excellence, and there's a lot of information, but there's no time to give it right now. I'd be happy to speak to whoever has comments or questions on that. And then the third is innovation through research. We hope to develop regional innovation through these anchor centers. So this is some progress today, just to give you a flavor of what's been happening. And basically, you can see, like in Jordan, there was imaging equipment that was completed. In Yemen, there was a diagnostic radiology through equipment procurement and so forth that's ongoing. In Syria, training for radiation therapy, some of it has happened, and so forth. And the very important thing is that the anchor centers in MENA, we have Morocco, Algeria, Egypt, Jordan, Pakistan, and Qatar already. And we have one more that's applied. So there's a lot that's going on. So back to the anchor centers, which is something that's very close to my heart, because I feel this has the possibility of having significant impact on the ground down the road for sustainability. You see here, there are expert missions that have gone to identify the needs, for example, and to put the work plan with the anchor centers together. This is Algeria and Morocco, and then training in Vienna. The interesting thing is that there's a lot of political support. So if you look at the picture on top, the whole first row is all the ambassadors from the different anchor center countries that are supporting this effort. So this is really a whole of society, if you want to call it, or efforts, yeah. All right, capacity building, there's a lot of opportunities. These are some examples of some training that happened. I won't get into details, but in Saudi Arabia, Kuwait, Egypt, Iraq, many other places. The program is quite significant that has the different projects. And as you can see, as an example, 25% of all projects are in human health. And as an example, just in nuclear medicine, in 1 year, we had 90 fellowships, for example, just to figure 60 expert missions and so forth. So we have the clinical training that I just mentioned, residency fellowships and all that we support, but we also have educational activities, workshops, seminars, online courses, and so forth. The online component is extremely important and has to be innovative as well to be able to reach people with interactive modules and so forth, and is available for free for anyone to download. Also, guidance documents are the same way, that range in the topic and also in what's being done, including setting up a cancer center from scratch. There is a call to action in radiology and radiotherapy from Lancet Oncology Commissions. I won't get into it in detail because of the time, but it's available, and this is a good roadmap for AMSTRO as they move forward. Policy examples, resolutions that we can support, evidence that we can produce, and then leadership role for stakeholder engagement through UN agencies or others, and then scientific evidence impact. So if we want to do global support, we want to be able to do proper planning, education and training, produce international standards, in your case, regional standards, quality management, and research. I'll say it again 5 times, research. So what could AMSTRO do? The interesting thing is when I saw the lecture on AMSTRO that started, a lot of these things were already thought of and are going to be done. So this is great because we have alignment, which is the word for this whole conference. So these are some, like setting up peer-to-peer review, quality assurance guidance, auditing and training, tumor boards to share best practices, regional plan for contributions, educational contributions. I think developing unified curriculum and certification is essential. So a collaboration at all levels. And of course, the Regional Research Support Network, which I'm really excited to hear that something is going on in that area. So thank you very much. Yeah.
Thank you, Dr. Wahab, for this wonderful presentation. So you gave us a lot of food for thought. You can be rest assured that we'll be reaching out to you from AMSTRO perspective to collaborate with IAEA to do, your last slide was about capacity building, clinical research. One thing we've been discussing is really establishing a clinical trial infrastructure. And that's where we'll be reaching out to you also to see how AMSTRO can collaborate with you to establish that. So with this, let's give our Dr. Wahab another round of applause, please, for that excellent presentation. So at this time, I would like to invite my good friend, Dr. Wilfred Ngoy, And